Nancy Albano. I worked very hard to elect President Obama because I believed in what he was proposing for the country. We hope to really impress upon Congress and impress upon the entire country from the bottom up that we need health care reform, and the time is now.
My name is Dr. George Bahadur. I'm here for Doctors for America. We have a grassroots level organization of physicians, approximately 12,000 in the country, rallying for health care reform. For us, what health care reform is to have an efficient system with checks and balances. We're all Americans. I am a veteran. I put my life, my welfare on the line during the worst extreme times, and this is an extreme time when we all have to come together and do something. We cannot allow this to keep going like this.
I worked in hospitals for many years. One of the things I had to do, in addition to my clinical responsibilities, was deny people care. And it was an awful situation to be in, to have to say to people, I'm sorry, your time here is up. Now I face the situation of being, like you, uninsurable because of my pre-existing health conditions. It keeps me up at night.
That's why we're here. And we're going to do something about it. Health care is particularly close to my heart, literally. I have a pig valve in my heart and in my aortic valve, and my health insurance runs out in December.
You know, I was seeing a spot in my eye one morning, so I drive to an optometrist, and he says, uh-oh, there's a problem. So he sends me to an ophthalmologist. I go to the ophthalmologist, and he says, you have a retina detachment. He says, you need surgery right away. You need it done on Monday. He says, go home, call the insurance company, and see if they will let me do the surgery on Monday. So I went home, called the insurance company. They denied it. You know? The doctor warned me. He says, don't let them hold you off too long because it's going to be too late. Well, it was too late. I lost the left eye is legally blind. I'm not in the dark, but you know, I'm legally blind. But you know, that was because the insurance company wouldn't let the doctor. You know, then I called a lawyer. I wanted to sue the insurance company, and I'm not allowed to sue an insurance company in Florida or something like that.
So I retired, and I was okay because I was on my husband's health plan. Well, 1 week later, he got laid off. So there was the two of us with no health coverage. We had no medical coverage as far as pharmaceuticals went. So I wound up having to go to Canada.
The doctors at Cleveland Clinic wouldn't even talk to me. They wouldn't even have a meeting with me to say, okay, this is what, here's what you owe, let's see what we can do. They wouldn't even talk to me, so I walked away from it. But I mean, what kind of a crazy system even allows that to happen?
What I went through in January would have probably cost $50,000 here in the United States. I didn't have health insurance at that time, but just before I left, I was diagnosed with a cancer. And when I went overseas, I found an oncologist and had some biopsies done. Ended up having 4 surgeries. The last surgery I had was last January, 2 weeks before I left that country. And I had 2 surgeons, I had 5 nurses, I had a pathology department work for me, I had the operating room for 3 hours, I was on the operating table, I had pre-op, post-op, the whole 9 yards. And medication, the entire cost was about $625 US. And the reality is our medical profession, the whole healthcare system is so broken. If you go outside of the country and you look into this country, you think, what kind of idiots are those, Americans? What is the matter with the Americans? We need to fix this so that people don't have to worry about losing their life savings if something goes wrong.